My name is MCCAFFREY. Today we're going to cover applying finger traps. Anybody that's ever done traction before? No, live patient? Nobody. Okay. This is a skill that you're not only going to use in the field environment, you can use in the clinic. Next slide. Terminal loading injector. Action, apply finger traction. Condition, given a simulated patient, verbal orders and necessary equipment, apply to standard. And our reference is SCP 8-91. Next slide. ELOs. These are your enabling learning objectives. What does that mean? Nobody. Identify the need for traction. These are the things that you're going to need to accomplish in order to accomplish your goal. These are like sub-task. Right? Identify the need for traction. Label anatomical parts. Match orthopedic terms and definitions, and identify equipment. Next slide. Purpose. Traction has 5 purposes. To prevent and reduce muscle spasms, immobilize, reduce, treat joint pathology, and relieve pain. Cool? Anybody not understand those 5? Next slide. Traction principles. To achieve traction, you must align the distal and proximal ends, remain constant, allow for adequate exercise and diversion, and allow for optimal nursing care. What does that mean? Beck?
Allow for optimal nursing care?
Correct.
What's that for the patient?
That means whatever procedure you're performing, whatever traction, you have to be able to the patient has to be accessible, right? You don't want to have all these pulleys and ropes and so on and so forth, and you can't even get to the patient. What if they crash, right? Next slide. 3 basic types of traction. Manual, skin, and anybody know the third? Skeletal. For manual, what's the parameters for manual? How long and how many pounds? There is none, right? Because for manual traction, it's momentarily, right? Apply manual traction, apply the device, drive on. So for skin, what's the parameters for skin?
4 weeks.
No more than 7 pounds or no more than 4 weeks, right? And that's due to what? More specific? Something to do with the skin?
Breakdown of the nerves.
Palsy, right? Nerve palsy. And breakdown of the skin, maceration, so on and so forth. Okay, and skeletal? A lot more than skin, right? No more than 30 pounds, and you can have them in traction for up to 4 months until it's totally healed. Next slide. Complications. Kind of touched on this a couple seconds ago. Development of pressure sores. Urinary tract infections. Pulmonary infections. What is that? You put them in traction, why would they have infections? Urinary tract.
They're probably catheter.
Okay. They're not ambulatory, right? You can't get up, barely go to the restroom. Females know what I'm talking about. They get urinary tract infections faster than we do, right? Nerve damage, we mentioned that. Palsy, with the constant traction for too long, right? Blood clots. Again, that's probably due to laying in bed for 3 to 4 months. These complications stem from a lack of mobility. There you go. Next slide. That's a picture of traction, finger traps. He's in his first and second digit. He's in the Chinese hand chucks type device. You're on the stand, and then it looks like he has 15 pounds on there. Again, there's a standard, and then if the physician decides that he wants to put him in 15 pounds of traction for 2 to 3 minutes to allow his muscles to relax and stretch out, come into alignment, that's fine. But you guys need to understand the minimum standards. Next slide. Everybody knows, since we're all orthopedic techs, everybody knows anatomical parts, right? Do we need to go over those? Next slide. Next slide. And next slide. A lot of docs, to make sure that they are performing the right procedure, they will ask the patient before they put them into general sedation, which finger, and so they're smart. And then after they do the procedure, they'll initially. Next slide. Common orthopedic terms. Orthopedic. Everybody knows that's a straight child, right? Subluxation, dislocation, fracture, traction, countertraction, and metacarpophalangeal joints. Countertraction, what is that?
Drawing your 30, pulling apart.
Where every force has an equal and opposite counterforce, right? So if you're pulling on the patient with 5 pounds, you might have to elevate them so that they don't slide off the bed, right? Next slide. And that's what a fresh fracture looks like. Notice the bruising and swelling in the fingers is starting to mess with the vasculature, and that pitch is going to have to be reduced. Next slide. Finger traps. These are things to you want to think about when you're putting in finger traps. They need to hang freely, never touch the floor, and tape all your knots. Next slide. These are the components. Stand, traction cord. Next slide. Spreader, says optional. Padded felt, next slide. The traps and other accessories, gloves, scissors, anything else. Next slide. Weights, that's a given, right? Or spring scale. Y'all freshmen know what that is. Next slide. Any questions? No questions. Next slide. Summary. Identify the need for traction. We went over that. Label anatomical parts, common orthopedic terms, and identify equipment. And thank you for the class. Got a 5-10 minute break, and we'll go on to the next subject. Thank you.